has the Indian drug regulator done a clampdown on injectable cosmetics via your IV drips, your glutathione injections, Botox, fillers, etc. under the scanner? We decode. Beauty injections, skin boosters, whitening drips, anti-aging shots. These treatments have become increasingly popular across salons, aesthetic clinics and social media promotions. But now, India's drug regulator, the CDSCO, has issued a strong advisory against the use of injectable cosmetic products. Why? Are these treatments illegal? And what risks do they really carry? Well, the cosmetic industry today promises quick transformations, fairer skin, younger appearance, instant glow and whatnot. Many clinics advertise injectable treatments as simple cosmetic procedures. But laws say cosmetics are products meant for external use, such as creams, powders, lotions or sprays. But once a substance is injected into the human body, it no longer behaves like a simple cosmetic product, and that's where the problem really starts. So, the products per se aren't illegal, but the way it is being used may be posing some problems. It may actually legally require approval as a drug or medical treatment if it is injected. Well, the Central Drug Standard Control Organization, India's national drug regulator, has warned that injectable cosmetic products can't be marketed or used casually as beauty treatments, as it is being done, as we've seen. This advisory also warns against misleading advertisements, false cosmetic claims, unapproved injectable products, and unsafe practices in so-called aesthetic clinics.
The law says that they cannot be injected or they cannot be used with any kind of needles. So that is exactly what it is. Okay. Now, if there are a lot of quacks, a lot of so-called beauty clinics or so-called wellness clinics, or even in parlors, beauty parlors, where a lot of these products are actually being used with needles, with injected or even given IV. Also, the doses are absolutely haywire. So we hear about and we see in our practice complications because of things which are done by very high doses. Okay.
Fact is, many people think cosmetic procedures are harmless. Cosmetic doesn't mean safe. Any injectable treatment requires scientific testing, approval, hygiene standards, and trained medical supervision. Health experts say the crackdown is not against any medically approved aesthetic procedures. Qualified doctors may still perform legally approved treatments under proper medical regulation.
If you are doing it for the right purposes, qualified doctors are allowed to inject certain drugs.
But there's a loophole there, no? What are the right purposes for glutathione, for example?
So it depends on every drug is different. I can't give you a standardized answer for one of them.
Understood.
But every drug is different. So if the drug is injected for the right purpose at the right doses, okay, which are safe doses, under proper monitoring conditions, then it is allowed to be injected by registered medical practitioners or for somebody who's board certified.